Hey everyone, it's Dr. Alicia here on the She Found Motherhood podcast. Today we are going to be talking to Kristen Yarker, registered dietitian, about how to start feeding your baby solids. She is actually the author of the Pediatric Nutrition Guidelines for Health Professionals in BC. So she's got tons of experience in starting solids. It can be such an exciting and fun time, but it can also be really frightening as a parent. There's choking risks, concerns around food allergies, and all kinds of different advice out there. This is actually one of the topics that came up in our pregnancy posse, but that our moms were really interested in learning about. If you haven't heard about our pregnancy posse, it's actually a membership site based out of Facebook where we have a group of moms come together who are near the late stage of their pregnancy and early postpartum period to help support each other. Dr. Sarah and I also do lives, and we have local experts come and talk to our groups. We also have a monthly Q&A, which is an open forum to ask whatever you like. So if you're interested, check it out. I'll put the link below. So let's get into starting solids right after this.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
All right, Kristen, so let's get into it. First of all, why have the recommendations around starting solids changed so much over the past 10 to 20 years?
They really have just changed so much. And I know it's created a lot of mixed messages and confusion among parents, but really it's because the research continues, particularly around food allergies and minimizing the risk for food allergies. And so as we learn more about that, we're changing the recommendations for introducing solid foods. So that really is the crux of why the recommendations keep changing.
And I know that we'll talk a little bit more about food allergies later and what to kind of do around that. But I know because of those recommendations, we're actually able to feed kids a lot more earlier on now. So it's actually a really good thing in terms of just being able to include your kid in your dinners, right? But so what do we know now around kind of what ages do we start? I usually kind of talk about when children show signs of readiness. So babies show signs of readiness. So some of those signs that I talk about is kind of, they need to be able to sit solidly in whatever you're going to feed them in. They need to be interested and keen. So some of the signs are staring at you when you're eating, trying to grab for your food, all those types of things. And I think we're going to talk about this a little bit later. They need to actually have the physical ability to swallow, to not choke on their foods. From a dietitian point of view, what kind of ages are we talking about?
Yeah, exactly. It's really that we're looking for all those signs of readiness. And just like any developmental stage, there's a window of time when most kids typically arrive, have those signs. And so for those signs you talked about and a couple more, it's really in that 4 to 6 month range. And so, yeah, I would just add a couple more. Definitely the staring at you and becoming obsessed with watching everything that you're eating and drinking. That's one. And then another one, as you were mentioning, is that they don't need to necessarily be able to support their own sitting up, like their torso, but they do need to be able to support their own head so that they're not really floppy. You'll remember when babies are really little, they've got that floppy head and they can't have a nice safe swallow if they're still in that floppy stage. And then another one that is quite important is that something that's called the extrusion reflex needs to disappear. And that's essentially the way I like to describe it, is that basically babies are born with the opposite gag reflex of us. And that's that when babies are born, anything that you put at the front of their mouth automatically makes them stick out their tongue. And that's why when we're feeding young infants, whether it's with breastfeeding or a bottle feeding, you put that nipple way in the back of the mouth so that you're bypassing that gag reflex. But of course, when for us adults, if you put something in the back of the mouth, it makes us gag. And so what we want to do is to wait for that extrusion reflex to mature and kind of move back into that more adult or bigger kid version where it's further back. And that usually happens in around that 3-4 month mark. I always like to say, little ones have arrived, are working on moving that gag reflex, that extrusion reflex into a gag reflex when they are at that stage when they're putting everything in their mouth. They suddenly are at that 3-ish months and suddenly everything's in their mouth, everything they can grab, their feet, anything is in their mouth. And it's actually that the presence of things in the mouth actually helps stimulate the movement of that reflex away from the extrusion to the gag. And so that's another piece that we're looking for happening.
That is actually a very great tip. Thank you. I'll be using that in my conversations now. So we've talked about kind of when to start, showing those signs of readiness. Most kids 4 to 6 months-ish of age. Now, keeping in mind that children can breastfeed exclusively up to 6 months of age, no problems. And so just really watching for those signs of readiness. And every baby is going to be very different. And there's no kind of clear defined, you have to do this or this or this. But usually by about 6 months, most kids are ready to start solids, some earlier than that. So how do you recommend starting solids?
I definitely recommend starting with iron-rich foods. And if people listen to our chat previously, we talked about why when you're pregnant, it's so important to be monitoring your iron levels. And that's because iron is really important for babies for overall growth and development, but particularly for their brain development, the cognitive development. And yet breast milk is naturally low in iron. And so it's really quite amazing that when babies are in their womb, they stockpile iron that they use for the first months of life. But at about 6 months-ish, their iron stores start to be tapering downwards. And so we want to be introducing iron-rich foods at about that time so that they can be having that external source of iron to be replacing the iron stores that they put in their bodies. So I recommend starting with iron-rich foods. And what we recommend is starting with iron-rich foods at least twice a day, and definitely adding a lot of variety of all the other foods on top of those. It's not like vegetables or fruits or other foods have zero value. Of course they have value, but those iron-rich foods are key to start building the repertoire of those foods up.
And so we know there's the iron fortified cereals you can start with, but so some parents don't really want to start with those. Are there any other recommendations in terms of those iron rich foods that you might tell a parent who's not interested in those iron fortified cereals?
Absolutely. And for those of us people who are watching us on YouTube or other videos, I've got a couple of demos that I brought. So yeah, a lot of variety of different plant-based and animal-based iron-rich foods. And so a couple of things that I brought, starting with I brought some lentils. This is from my pantry, as you can see. And I love these red lentils because when you cook them, they already form like a mush. So they already form essentially their own puree. But even the larger lentils or beans as well, particularly as long as they're not too large and would cause a choking hazard, beans or lentils are a great one. And then another iron-rich food is tofu. Tofu is a great iron-rich food. This one I have is a soft tofu for people watching us our video. But soft tofu, again, already essentially a puree, or you can take a firm tofu and cut it up into finger food pieces. So those are some great ones. I've got some fish here. We're here on the West Coast. We love our seafood. And so fish is a great iron-rich food. And so I just poached this one ahead of time, but you can just break it up into tiny little pieces and make sure there's no little bones in there. That's a great iron-rich food. Of course, things like red meats and poultry are great iron-rich foods. And you can, I've got some ground meat here. I love to use a little hand mixer and just put it in the jar of the hand mixer, a little warm water, blend it up. There you go. You have a little red meat puree if you're a red meat eating household. Also things like nuts have a little bit, seeds have some decent iron as well. And so something like tahini or hemp hearts, you can offer them individually, or you could do a butter of a seed very easily. And what we recommend doing when you have butter, just because that can be a little bit of a choking hazard because it's so thick and gloopy, what we recommend is just thinning it out with a little bit of warm water so that it's not as thick. So I thought I could just show a little live demo here for your video audience. I've got some seed butter in here. I'm just adding a little bit of warm water. And you just do it so that it's no longer that thick, gloopy consistency. I don't know about you, but I love a nut or a seed butter. So I've been guilty of, just going into the fridge and like sticking some on a spoon and it looks like you know what I'm talking about.
We did it at the same time for those of us who can't see me on video. Same motion.
With a smile on our faces. Yeah. So that glob, that can be a bit of a choking hazard just because it can stick. So instead, you just want to mix it with some warm water until it's a bit more of a thin, viscous kind of slurry. And then you can feed that directly to baby. You can mix that in with like an infant cereal, some homemade oatmeal, an applesauce, anything like that. Yeah.
Awesome.
A great way.
Those are some great recommendations. So I know historically we used to say when you're starting new foods, you start a new one every 3 days so you can see if they have an allergic reaction to it. But I think the evidence around that has actually changed. Do you want to chat a little bit about that?
Absolutely. Yeah, that has changed. And I'm so happy about that because even a dozen years ago when I was teaching parents, that's exactly what I taught because that's what, the evidence then was around. But, I always felt so badly for these poor exhausted parents who had to try to remember what foods that they did on what day when all the days are blurring together. And so it's so great that what the research shows is that having large gaps of time between introducing foods was not protective in any way around preventing food allergy. So why the heck make exhausted parents try to remember all this? And in fact, what seems to be from the evidence is that introducing the foods earlier on, once you've introduced solids at around that 4 to 6 months, and getting those foods introduced, fairly quickly earlier on, that perhaps is more protective. So yeah, the foods we don't have to do one at a time anymore. You don't have to wait a certain number of days in between. You can just get on rolling and introduce the wide variety of foods. But we do recommend a few foods introducing singly still. And those are the more common food allergens here in Canada. And it's not that you need to wait a certain number of days in between, but it's just that these are the foods that are more commonly have a reaction. And so if you introduce them all in one meal and baby does have a reaction, we just don't know which one the heck baby reacted to. So it's just from that practical point of view of being able to track back if there is a reaction to know which one it was to.
Awesome. And then one other quick question around that. Are there any foods we should not be introducing until a little bit later?
Yeah, but actually, before I even chat there, I should mention what the heck the common food allergens are so that parents know, and caregivers. So the common food allergens are, in Canada anyways, are eggs, dairy, soy, wheat, peanuts. Of course, everybody's heard of the peanuts. Seafood, so fish, shellfish, and tree nuts. So those are kind of all the other nuts that aren't peanuts. As well as sesame. So those are the more common allergens. And as I said, we do recommend introducing them one at a time just for that practical purpose.
And now when you say introducing those one at a time, because I think people are going to get confused, singly or with something that your baby hasn't reacted to before?
Oh yeah, totally with things that baby hasn't reacted to before. But say, I don't know, maybe you haven't ever given your baby wheat or eggs or fish, and you decide to give baby a fish cake that's made with some breadcrumbs and egg and fish, and your baby has a reaction to the fish cake, we wouldn't know which of those three it was to, right? So, but if you'd already given your baby egg and wheat before and fish was the only new thing, then chances are it was the fish. But yeah, we do recommend just one at a time. But yes, absolutely continue with the other foods that you've already introduced. Thanks for asking that one.
Perfect. All right. So any foods that we should not be introducing kind of in the first couple of months?
Yeah, and there are a few. Again, most foods are wide open now, which is great, but there are a few, mostly from a food safety point of view. So preventing what we in the industry call foodborne illness, but we kind of in general we talk about getting food poisoning. And so those are things like honey. We do recommend waiting until after 12 months for honey. And that includes honey that has been cooked. So honey in like a baked good, so like a muffin or something, but also honey in any meat marinades. You want to wait until after 12 months for honey. Also, we do recommend for raw cheeses, raw milk, raw fish, raw seafood. Here in Canada, we're super, super protective. So we recommend waiting until about 5 years or so before you can take little kiddo for raw fish sushi or some steak tartare. And then for eggs, there's a few different ages for different preparations of eggs. So for under 12 months, we recommend both the white and the yolks to be hard. So like a hard boiled egg, or if you're doing like an omelet or scramble, you want to do them really well done. I like to say you want it more like an American diner than like a French preparation of scrambled egg or omelet, like nice and well set for under 12 months. When after 12 months of age, between so the 1 year, the 12 months, and 5 years, that's when you want the whites to still be hard, but the yolks can be runny. So that's when soft boiled eggs can be introduced. I know I was raised on a steady diet of we call them eggs and soldiers. I know some people do
with your toast
eggs.
Points.
Yeah, well, we had them into little rectangles, and so they were lined up like little soldiers. So that's what we
fancy egg cup.
Yeah. So
I
that's
think we
after
might be
1
the
month.
same generation.
So after 12 months for those, or an over easy egg, a fried egg, that type of thing. And then again, super safe in Canada, we recommend waiting until after 5 years for the raw egg, the whites to be raw and the yolks to be running.
Gotcha. Perfect. And what about dairy? Because this is something, right? We usually don't suggest milk until after the age of 1. And then maybe I'm wrong, I learn a lot from you every time we do a episode together. No other dairy products prior to 9 months of age. So yogurt, cheese, that type of stuff. What are your recommendations? Because you were the expert.
Yeah. So, little bites of yogurt, little bites of cheese, or, other products that have been made with dairy are fine at those younger ages, from the time you're introducing solid foods onwards. What we don't recommend is having like cups and cups of milk, like what we call fluid milks, like glasses of milk, before that 9 to 12 months of age. And that's, again, 9 to 12 months. It seems like that's a wide range in ages, right? Because when little ones, like that's a big amount of time in their, your infant's life. But what we're really looking for, again, turning back to that story about iron, it's that the dairy foods can really inhibit or lower or block the absorption of iron. And so what we're looking for is a nice solid repertoire of iron-rich foods before we introduce cups of milk. And so some babies, they really pick up on this eating solid food thing, and they're putting lots back by 9 months. So then, hey, go ahead and introduce cow's milk as a fluid if your family drinks milk. But some babies, they're a little slower on the uptake. They take a little bit longer to learn the skill of eating. So those are the ones we would recommend waiting until 12 months before introducing the cups of milk. And then while I'm on milk, I like to mention that I consider milk, like cow's milk, a big kid food, not a baby food. And so I recommend introducing cow's milk in a cup, not in a bottle. Like if your little one is drinking from a bottle, they're not ready for cow's milk. What goes in a bottle is breast milk or formula or water. Those are the things that go in a bottle. So if they're ready for a big kid cup, then that's when they're ready for the cow's milk.
And the other reason that we recommend that from our point of view is a lot of people give their babies bottles before bed or in bed. which if you're getting milk in that has high doses of sugar, and it's going to cause dental caries or cavities. And so that's another reason for no milk in bottles, another good reason, right? They can drink it with dinner, or they can drink it before they go to bed, but make sure you brush your teeth and then put them to bed after that.
Yeah, and that's the natural milk, the natural sugar that happens to be in milk. It's not that they add sugar to milk, but yeah, you want to brush your teeth before bed, just like we do as adults. So
exactly. Awesome. So we've chatted about when to start solids. We've chatted about what things to start with and what to maybe delay. And now anything else that we need to add to that before I get on to what gave me a lot of angst and worry with my first child, not with my second, but with my first child, around how to start. The whole question of what's better, baby-led weaning, giving them purees, we going to ruin them by doing the wrong thing? Will they not have like their small motor development if we don't do baby-led weaning? How do we start it? I know the answer now, but.
Well, before we get into that, and I definitely want to talk about that, I just want to mention something that is almost more, I guess, of an overarching thing, or almost like a philosophical thing. And that's that when we're introducing solid foods, we're really doing three things simultaneously. One is that we're meeting their changing nutrition needs, right? And you heard me go on and on about iron. That's the changing nutrition need that we're looking to meet. The second is that learning to eat is learning a brand new skill for babies. This is a skill development. In fact, I've been talking with occupational therapists and physiotherapists who also work with kids, and what they taught me is that learning to eat is actually the most complex motor skill we ever learn as a human being. You know, I think it's fascinating that in our culture, we celebrate, rolling over for the first time, we celebrate first steps, but those things are like easy peasy compared to what's involved with eating. And so we need to give kids the opportunity to practice and learn this skill. And then the third thing is that we're want to be helping our little ones develop a healthy relationship with food, like even from the very beginning. And so really we're doing those three things simultaneously. We're meeting their changing nutrition needs, we're giving them the opportunity to learn the skills, and we want them to be developing a healthy relationship with food. And so that kind of principle overarches what I teach around introducing solid foods. And I think it also gets at a little bit about what you were talking about just there about, which way should we be doing this, and how the heck do we prevent the scary thing of perhaps baby choking.
Yeah. And I think, and another thing that I think is really important is food is a big part of our culture, but the family meal, I think, is such an important part of family life, and teaching children how to be a part of family and a part of society and a part of culture, because that's where our conversations happen. That's where we kind of see other people doing new things. So for kids, I think it's really important. And in our crazy, hectic lives these days, I think we're missing out on this, but actually sitting down for a family meal together from a young age. So even if your child isn't starting solids, bring them in on the family meal, because they start to see you eat and they start to learn about that. They hear the conversations, and it's a much bigger thing than just eating as well. And so I know as toddlers, I suspect, family meals are great because they're seeing you eat and try all these new different things. So they might not try it, but they're actually seeing you model that behavior to them, which is a really important thing. So I think including your baby at least once a day, if you can, in the family meal, I think is a very important thing. And that goes towards that kind of, what are the goals here, right?
Absolutely. And they learn so much by watching you. Like your baby will learn more by watching you eat than you could ever do teaching baby. And so I like to say, and I took this phrase from Alan Satter, who is a dietitian in the States, who has led a lot of great research and education around feeding kids. But your goal when introducing solid foods to your baby is you want to be starting to transition your baby to the family table. We're not all joining baby at the high chair. So I like that, bring baby around to the family table, manipulate your family foods for baby so that everybody is kind of eating together. mean, obviously I don't recommend waking up a sleeping baby to do that, but if there are times when baby is awake, alert, interested, and it's a time when you could be eating in your family, those are the ideal times to be introducing
For
solid
sure.
foods.
For sure. So can we get into the topics of how to start solids?
Yeah.
What actual methods do we use?
Absolutely. So if people have been, doing some research around this, or, doing Googling, or just talking to their other friends who, or have babies, they'll probably have heard that there's the Puree method as well as the finger food method, which some people call the baby-led weaning method. And I have been teaching actually a bit of both. I love both. Because, for example, today I had oatmeal at breakfast and I had a sandwich at lunch. So guess what? I had a solid food in my sandwich and I had oatmeal, which is a puree for my breakfast. So it's good for skill development to learn both. And even way back when I was helping to develop the British Columbia recommendations around introducing solid foods, even 15 years ago or so, we were recommending introducing the finger foods as early as 6 months. And so still, I'm a big proponent of that. And I love how the baby-led weaning movement has highlighted that and really brought awareness to introducing those finger foods early on. Some things that I've seen as it's kind of evolved that I think is unfortunate is that there seems to now be like these two camps that you have to choose puree versus baby-led weaning, and one is right and one is wrong, and you're either one versus the other. And I'm just like, why do we need more like judgment against parents and the way they're doing things, right? Like, I think both are awesome. And from a skill development point of view, both are fantastic. So I don't think people should have to choose one camp or the other. I don't know why they're camps, because both do the same thing, which is to prepare the food in a way that minimizes the risk for choking. And that's really what we want to do for babies. Because they're learning this brand new skill, right? So just like how babies, when they're learning to walk, they stumble, there's some bumps and bruises along the way. Babies are going to do a little bit of gagging and figuring out how to do this skill of eating. And so we want to be preparing foods in a way to minimize the choking hazard.
I think another really important thing to note is every baby is different, and every baby's skill set is going to be different, even at the same age. And if I know when I was researching baby-led weaning with my first son, because one never does these things with their second, because they've learned that it's going to be fine regardless. There were these forums that were just chastising. They were horrible to people asking about purees, and it's not going to work for every baby. Every baby goes through stages. Some are super particular about the texture of their foods. Some of them may not have the hand-mouth coordination, which they need to have with baby-led weaning. And so you just got to do what's right for your baby and for your family. And that's the same thing with all infant feeding methods. You do what's right for your baby and your family, and that's going to be different for everybody.
Absolutely. I've helped thousands of families and I've seen thousands of kiddos over time, and most kids are somewhere kind of in the middle. And then I've seen those little ones that I call the happy little outsourcers, who are like, why would I do this feeding thing? You're so good at it. And they'll just sit back. So you have to kind of feed them. And then I've met those other kind of extreme ones on the other end who never accepted a spoon or a fork or a piece of food wielded by someone else. They had to do everything. And most babies are somewhere, in between there. But, so as you said, a lot of it is like judgy and all this kind of awful stuff. But what is important is that you're providing a variety of foods for your little one. And B, that you've got those iron-rich foods in the heavy rotation. And then C, that you're preparing the foods in a way that minimizes that choking risk. So I just want to take a moment to differentiate choking versus gagging, because they are two very different things, but we kind of in general tend to associate them together. And so choking, of course, is the scary one where something goes partway down baby's airway and blocks it, and baby can't breathe well. And that's what we want to avoid. Gagging, on the other hand, is actually like a good thing. It's actually one of Mother Nature's protection mechanisms to help clear foods from falling back a little bit in the mouth so that they don't get into that airway. And so it's bringing the foods kind of back out to keep that airway clear. And of course, we as adults have negative associations with gagging, because gagging we either think of an association with choking, which is scary, or with throwing up. Yuck, right? So we have negative associations with gagging, but babies have no negative associations with gagging. I don't know if your kids, or if you've had, parents you're supporting whose little ones like figure out they can put their fingers in their mouth and they can gauze themselves to gag, and the babies do it like over and over and over again. Oh,
Never been pleasured by that one.
oh man.
Goodness.
Oh, when I'm talking in a group, there's always at least one parent who's like nodding their head, like, oh, and it's like so horrific that we're like cringing, and baby's like, oh, look what I can do. Look what I can do. Oh, but yeah, babies have no negative connotation with gagging. They have, all sorts of bodily functions that just seem to happen to them. They have no clue. But if we have big negative reactions to a gagging, like where we go big swooping in and scared, babies are really well tuned to our emotions. And so they can then learn that there's something scary in this eating thing. So it's important to, have a little so you can express a little concern, but to try to keep yourself in check, and remind yourself like gagging is a protective thing. Gagging is a good thing, so that you don't have like a big negative association that baby learns with eating. And so with the foods, what we want to do, as I mentioned, is prepare them in a way that minimizes the choking. So getting partway down the airway and stopping. So either we prepare the foods so that they're really soft and mushy, so that even if they go down the wrong way, there's nothing going to block. And that's traditionally called the Puree Method, right? When you make a puree, or if you even chose like, I don't know, ripe avocado or ripe banana or something, as I said, my red lentils that are naturally soft and mushy like that, that's not going to block anything, right? It's just going to keep slip sliding down, no airway blockage. The finger food method, what we want to do is prepare foods in a way that won't block an airway, even if the more solid food goes down the wrong way. And so with the finger food style, or the baby-led weaning style, what I recommend is preparing foods. I'm a big fan of what I call cutting things in like skinny finger shape, because a cube or something round does tend to be more likely to block an airway. And so preparing it in a skinnier version is helpful. And I've got, I prepared some hard-boiled egg for people, connecting through us through video, and the yolks of eggs happen to be rich in iron. That's one food I didn't have a chance to mention earlier. And so I prepared the hard-boiled egg, and I cut it into some what I call skinny fingers, so that baby can pick it up and eat the hard-boiled egg this way. You could also do scrambled egg or omelet and cut it into skinny fingers that way. And I also like a skinny finger, particularly for the youngest of the age, because when they first start introduced finger feeding, they don't have what's called the pincer grasp, where they can do what I'm demonstrating here, where pick things up with their thumb and forefinger. What babies do is they scoop it up in their palm, and when they're really, really beginning, they don't know how to open their palm to get the food out that's in there, and they can get really frustrated. And so I love a skinny finger, because then when they grab something, there's also a good chance that some of it will be sticking out of their hand, and they can munch on it too. So from a mechanics point of view, as well as from a preventing choking point of view, cutting things in skinny fingers are a great way to prepare that. But also, as we talked about, skill development, right? We want babies to learn how to manipulate different textures of foods in their mouth, how to pick up and self-feed themselves. And so that's a great thing that the baby-led weaning kind of style feeding really contributes. And kind of a perhaps downside to that is often people aren't thinking of the iron-rich foods. They're often thinking like the vegetables and the fruits, and that's what they give by finger foods. But we want to be providing those iron-rich foods there.
Awesome. A couple that I use, again, not the iron rich, is but there's a banana, and you can put your thumb down the middle and it splits it into 3. So that's an easy way of doing the bananas, or the sweet potato, like you just do your own home baked sweet potato kind of fry type things.
Yeah, but you could roll those in some hemp hearts, or smooth, scoop some nut butter or seed butter, on the banana, right? Like banana and peanut butter is a classic combination. So you could smear some in there, and that could be, a way to make it more iron rich.
Awesome. Great. Well, that is a whole whack load of information, but a great primer on starting solids in your babies. So, Kristen, if people want more information, how can they get a hold of you?
Yeah, the best way to get a hold of me is by email, which is kristen@kristenyarker.com. My website is kristenyarker.com. I'm also on Instagram at Kristen Yarker, and I'm on Facebook at kristen.yarker. And then a little bit confusingly, I have a YouTube channel where I do YouTube videos a couple times a month, and that's at Vit K Nutrition. So VIT is in vitamin, K is in Kristen Nutrition.
And we will link all of that in the show notes below. And you have a book as well, I'm pretty sure.
I do. It's a cookbook for, well, the whole family. And yes, I have that from my website. You can purchase it through my website as well, or any Amazon, or have a bookstore come in, and that's the sugar detox diet.
Awesome. Great. And a lot of extended benefits actually cover dietitian services. So if you are struggling, if you've got a kid who's picky, or you're pregnant and want to know about your nutrition as well, I'm sure that you would be happy for people to reach out with you around that as well.
Yes, absolutely. To inquire about sessions, what I recommend is heading to my website and booking the information call. So then we can have just a brief chat so I can find out what's going on for you, and you can ask me questions about my approach, and then that way we can determine if we're a good fit for booking a session. So yeah, head on over to kristenyarker.com to book that.
Perfect. Awesome. Well, thank you so much.
It was great to talk with you today.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.